this is Jessica DeMassa at the HISA Studio here at HIC 2017, and I'm here with Vishaal. Please introduce yourself for everybody watching.
Hi, I'm a Professor of Innovation and Public Policy at RMIT University, and formerly the Deputy Secretary in the Department of Health and Human Services in Victoria.
Okay, so right before we went on air, we were having an interesting conversation about the unique predicament of the Australian healthcare system, and so I'm going to make you on camera describe what that is.
Yeah, great. So, I mean, it's a really interesting time of change in our healthcare systems, in our systems. It's not just one, there are many in Australia. And it's really, you can see on the demand side, so much is changing. It's really a volume, composition and complexity story. Increasing demand, changing nature of that demand, really complex burdens of chronic disease and complex disease, making the picture really, really complicated. At the same time, on the supply side, governments are trying to fix their budgets. They're trying not to overspend. They're trying to become really, really disciplined and efficient in the way that they fund healthcare services and fund healthcare generally. And all the while, this amazing transformation is happening in technology, in the relationship between patients and clinicians and patients in the systems. No longer is it the case that patients just sit there expecting things to be done to them. They're empowered more and more. They want information. They're willing to check out Dr. Google before they go and see their GP. They want to know more about their own health. And this creates really different dynamics in the system. It's a really interesting time and a really difficult predicament for people in the healthcare system as they look forward at a system that looks completely different than the way that it does now in the future.
So what's the solution here then? I mean, how do we move forward? Because I mean, there's competing interest here, but ultimately there is a common interest in the sense that everybody wants healthcare to be better, and more effective and have better outcomes and things like that, be less expensive. So how do we move forward? Let's fix our problem for us.
Oh, fantastic. So we've got 3 minutes, so it'll be great. So I think one of the things that we really kind of need to pay really special attention to is healthcare is not like other industries. If you ask any of these people who are around here or any of the speakers, time and time again you'll ask them, why do you do what you do? And they could be healthcare policymakers, they could be hospital administrators, they could be CIOs, they could be students, and time again they'll say to you, I want to help people, I want to care for people, I want to make people better. Healthcare is one of those rare places in our society, in our economy, where people are really motivated by care every single day. So we need to find a way to harness that intrinsic motivation for big change and small change and improvements. And how do we do that? For me, it's about building coalitions between different parts of our system, the healthcare department, or the health departments, the hospitals, the new technology entrants and the entrepreneurs, the informaticians, of course, and the clinicians and the nurses. We have to build these interesting coalitions. And the way that we build them is around purpose, around that caring, around that well-being purpose. And if we use that as our kind of guiding light, we can pull people together in networks, we can pull people together in conversations, and together we can have multiple layers of attack on complicated healthcare problems.
How can technology assist this?
Yeah. So technology is we have to be really careful when we think about technology.
Okay.
So technology is a bunch of apps and electronic medical records and computer systems and hardware. It's all of those things. Mm-hmm. But there's more to technology than just these kind of gadgets and bits of software. Technology is anything from an economic point of view. Technology is anything we use to produce outputs better. So it includes how we train people. It includes the way we organize ourselves in a hierarchy or in a flat structure or in any of these kinds of things. So for me, technology really broadly is a critical enabler of how we do things differently, how we generate new ideas, how we create new value through new action. But, I think we have to focus on the human story all the time. We have to focus on the human purpose of what we're doing. We have to focus on the human creativity of the way we come up with solutions to new problems. And we need to focus on the human challenges of changing a system. Technology will come and help us in all kinds of ways, but it's the human story that I want to tell really strongly.
So last question for you. I'm just curious. So I mean, we started out with a predicament and we walked through, an approach toward a solution here. So what has you most excited, I guess, for the next, let's say, 5 years as this solving of the predicament begins to unfold? What has you most excited about healthcare here?
Yeah.
Healthcare innovation in particular.
Yeah, beautiful. So I think there are kind of two sorts of things. One is, so I'm involved in a lot of these new medical technologies and entrepreneurship in respect of medical technologies. I see many students and many small businesses that are starting up, and the technologies that they have, Jessica, are amazing. It's Star Trek stuff. We're talking about implants that can help people to walk after they've had, catastrophic injuries and quadriplegia and paraplegia. We're talking about things that can just sit around your wrist and constantly be saying, are you about to have an anaphylactic shock? Are you about to enter into some kind of other healthcare condition that we would never know until it actually happened to you normally? So predictive stuff. So there's these amazing technologies which are changing things. Remarkable. That's great. And that's really exciting and interesting, and you feel like you're in a sci-fi movie, and that's great. But the thing that has me the most exciting is that we all, as we've talked about before, all of us here have this motivation to do something for people, for community, for society. And what this moment in time gives us is that the chance to really increase the effectiveness of what we're doing through technology, through new communities, through new ways of talking to each other, and through this predicament that gives us all kinds of opportunities and challenges. We might actually really change our healthcare systems in remarkable ways, and that's really exciting.
Fantastic. Well, thank you so much for talking to us about the complexity of the predicament here, and also your vision for very optimistically, I guess, moving forward to solve it. Thank you so much. This is Jessica DeMassa in the HISA Studio here at HIC 2017. Thank you.